All right. Okay, so this session, let me just do a quick introduction on myself. All right, so I'm Mr. Chan Zili. Okay, I'm the Assistant Chief State Commissioner for Senior Scouts in the PPKL. I'm also the Assistant District Commissioner for training in PPM Daerah Seputih. I'm the Senior Sea Scout leader for 30th Sea Scout, Segambut Sea Scout Open Troop, as well as the Assistant Cub Scout leader for the 16 Lembah Pantai Cub Scout Pack. I'm also the Secretary General for the King's Scout Brotherhood of Malaysia, as well as I'm the Assistant Leader Trainer. All right, in the line of first aid related, I'm a trainer, a registered trainer with the Malaysian Red Crescent Society. I'm also an instructor for the Life Saving Society of Malaysia, as well as an assistant instructor for Wilderness Medicine Institute. All right, in US. Okay, so this is a very brief information about myself. Okay, now what you will have covered over the website, so you should have covered all these 17 topics. All right, number one will be the severe related to severe allergic reaction. Number two will be asthma attack. You have covered bleeding heavily, broken bones, stroke. You will have covered a little bit about burns, choking, head injury, heart attack, a bit of hypothermia, although it may not happen so much in Malaysia, but however, if you go to places, cooler places, you may get if you are not well protected. All right, meningitis. Okay, there's a swelling in the brain. All right, strain and sprain. Right, you have covered seizure or epilepsy, or in Bahasa will be sawan. Okay, you will have covered poisoning or harmful substance. Right, and also you will have covered part of CPR, which they broke out into three, which is unresponsive, but the patient is breathing, and unresponsive, but the patient not breathing, and also unresponsive, patient is not breathing, and you have an AED with you. So this will be the 17 topics that you will have covered from the website. Okay, just for your information, this is a very, very basic first aid, all right, because you're actually learning it from the website instead of face-to-face interaction, and because of COVID, so we won't be doing much of a practical session. Okay, that's why I introduced this to everyone, all right, in terms of learning a little bit of first aid while you are at home. Okay, and you can learn through the website. Okay, if you went through most of the you went through the website, actually you can explore it yourself. There's actually another portion where it comes with video. The one that I've shared with you, it comes with a quiz, but it's all mainly text and PowerPoint slides. But there's another part of the website that actually has some short video for you to, for those who like to watch a bit of video, okay, a bit of moving, and it also covers most of all these 17 topics, right? For those who would like to watch videos. All right, so you can actually, let me try to share with you, if you can see if I can find it. Right, so if you go to the website, okay, this is the one that you went through. All right, this is the one that you have would have gone through. Okay, so if you go to the actual website, okay, the British Red Cross website, okay, this is the champion one. All right, if you go to the redcross.org, right, you go into first aid, learn first aid skill, right, this is where you can actually view similar one, but it comes with video. So for example here, if you scroll down, all right, the steps are here, down here there's a video. All right, so if you want to explore more, you can actually go ahead and explore and learn. This is also can be found in this YouTube as well. Okay, posted by British Red Cross. All right, so let's get back here. Now, before I continue, anyone have any questions from these 17 topics before I go into a little bit more specific to your Lencana Ahli Pertolongan Cemas topics? Anyone have any topics? You can unmute your mic, or you can type in the chat group. All right, so feel free to do that. For those who have yet to complete any of this or just completed a few, you can do this. You can do it after this at your free time. All right. However, at the end of this session, there will be actually an assessment, okay, or a quiz, right, for you to do, and then upon completion of these 17 topics plus the quiz, you will be issued a certificate of attendance. That means you have covered the basic 17 topics here, as well as what we have covered in this webinar. All right, so there's a certificate for you. You can actually put into your logbook as a proof that you have completed your first aid training, okay, during this COVID period. All right, so it won't be any face-to-face training, okay, as yet. All right, but this is what we can do best during this MCO period. Right, so I see in the chat group there's nothing much, so I guess you guys are all right. So we can actually proceed with what I'll be covering a little bit in terms of for your Lencana Ahli Pertolongan Cemas. All right, in your Lencana Ahli Pertolongan Cemas, okay, for pangkat muda, there are actually 7 areas that you need to cover. All right, you need to know a bit on human anatomy. You need to know about pressure points and bleeding. Okay, you will have covered bleeding in your online session. All right, but the pressure points actually is not covered. All right, but that's where I'll be sharing with you later. Okay, you'll be covering shock and electric shock as well. This is also wasn't covered during your online sessions from the website. Okay, and as well as bandaging. Okay, bandaging is actually a little bit of a challenge for me to teach over this webinar session at least, but I'm actually trying to do a little bit of a trick where I'll be doing a little bit different method, which I'll be sharing with you later. Okay, right, and then we'll be covering fracture and splinting as well. All right, and we will do a bit of practical of cardiopulmonary resuscitation, which technically you have covered over the web. Okay, but we will try to do it today. Okay, that's why I need you to have a bit of an open area, probably with your pillow nearby. Okay, so your pillow will be your mannequin. So I will want to see roughly how you compress, where do you put your hand, how deep you compress. So just a little bit of a practical session there. So at least you know you are able to do. Okay, and then of course we'll do a little bit on what do you need to tell when you want to get help, okay, over the phone when you dial 999. So these are the 7 topics that you need to know for your Lencana Ahli Pertolongan Cemas. Right? So next, I'll go through very quickly on human anatomy, okay, because I know some of you Form 4, you will have covered most of it already. All right, for those who are younger, Form 1, Form 2, or even Form 3, you may have covered some in your science. All right, so for first aid here, I'll be covering a little bit of it, but as a very simplified version, okay, just more related to first aid. Okay, right, so number 1 is actually our circulatory system. All right, so our circulatory system, all right, the structure, it consists of the blood itself, right, the vessels, okay, and then the heart. Okay, so the heart is the pump, right, the heart is the pump over here. The vessel is where it brings all the blood to the whole body. All right, so it consists of these 3 things. That's your circulatory system, right? So what's the function of your circulatory system, right? It maintain perfusion pressure. All right, so that's where blood pressure comes in. All right, so you have to have enough pressure, right, to push the blood, right, to all the cells, to all the organs, okay, for it to absorb. All right, and then of course to circulate oxygenated blood to the whole body. All right, of course, as well, at the same time, after it brings oxygenated blood, it will also bring what you call that secretion, okay, from the tissue, from the cells, right, back to the heart, and then it will go to the lungs, Okay, that is for exhaling, okay, as well as it will bring to the kidney, the liver, all right, so for it to secrete out, okay. So what is the problem with circulatory system, all right? In first aid, it will be shock, okay, which is inadequate cellular oxygenation due to inadequate perfusion pressure, okay, meaning this is your cell is not getting enough oxygen. All right, inadequate perfusion pressure. So if the blood pressure is low, your cells won't get enough. Or if you do not have enough blood in the body, usually due to bleeding, right, you will go into shock as well. All right, or you'll have problem with your heart. Right, that's why I show here there are three structures. So any problem with any one of these, it will lead to shock. Okay, we will talk a little bit more on shock later on after this. Right. Next, we have our respiratory system. That's your breathing. Right. So the structure, you have your upper airway, okay, which is up here. All right. And then you have your lower airway. All right. Deep inside is your alveoli. All right. As well as people sometimes forget. All right. Is the chest wall and the diaphragm down here. All right, it also helps to function in terms of respiration and also the neural drive, the one that drives it to breathe in and breathe out. All right, so the function obviously is to oxygenate the blood, okay, as well as to regulate the blood pH, okay, the acidity. All right, this one also is the function of the respiratory system. Okay, so what's the problem with this? In first aid, we will actually, the worst is what we call respiratory failure. That means the person totally could not breathe. Okay, the lungs is not functioning. All right, cannot get in oxygen to the blood. All right, so that is a respiratory failure. All right. Next, we will have our central nervous system. Okay, one of the vital system as well. Okay, the structure, it consists of cerebellum, brainstem, and cerebrospinal fluid. Okay, right. So cerebrum, I think all of you would know this will be the biggest part. All right, cerebellum, and then you have your brainstem. Okay, and then around it, okay, is the cerebrospinal fluid, because you know our skull is protecting the brain. Right. So the brain is soft, the skull is hard. So you need something to cushion it. Okay, that is what we call the cerebrospinal fluid. Okay, so the function, right, it controls the voluntary action and also involuntary control. Right, voluntary action, that means what you want to do. All right, you want to raise your hand, you want to blink your eye, right? So that's voluntary. Involuntary, like how your heart is controlled, your breathing is controlled. Right, you cannot tell your heart to, okay, I need to stop now. No, right? It's automatically the brain, it controls the heart for it to function. All right, although like breathing you can control for a while, you can force it to stop, okay, but after some time you also breathe again, because it's detecting you are not having enough oxygen, so it needs to breathe, so you also overrule that. All right, so what's the problem with this? All right, will be the worst will be what we call brain failure. That means your brain does not function. All right, so this is the worst case that you can get for things that relate to your central nervous system. Right, then we have our musculoskeletal system. Right, basically, right, the structure are, okay, you have your bone, your cartilage, right, your tendon and your ligament, all right, as well as the muscle, okay, and fluid. All right, so the function of this, they have a lot. Okay, one is to support, all right, to give support for you to stand up straight. Okay, right, and mobility. Okay, that's where your joints comes in and your muscle comes in, as well as it provides protection. Right, that's where like your skull comes in to protect the brain, your rib cage comes in to protect your heart and your lungs. All right, so that is one of the function, the few functions of your musculoskeletal system. Okay, so the problem would be, okay, what we call stable injuries and unstable injury. All right, one of the thing that some people will actually say, okay, that most of you heard about is what we call sprain, okay, which usually happen around your joints, okay, and of course the worst one will be your fracture. All right, so you may have stable injuries are generally what we call sprain. Okay, unstable injuries will generally be fracture. Okay, however, I put it stable and unstable here, right? Because most of the time you wouldn't be able to differentiate what is fracture and when is it sprain. Okay, because usually it's both looks similar, and you are all of us are not Superman where we have X-ray vision to see whether is it the bone or is it just a joint. All right. Usually, if you're right in the middle of the bone, okay, then you will be able to say it's a fracture. But if it's near the joint, all right, it may be a sprain, it may be also a fracture. So that would be an issue there. All right. So sometimes we will in medical term they would actually generally call it stable and unstable injuries until they perform an X-ray to determine is it really a fracture or not. Okay, and ischemic emergency is whereby when, for example, when there's a fracture or even a sprain, okay, when your whole body parts swell up, okay, it will tend to block the blood circulation to the extremities. Okay, so that is a ischemic emergency. Okay, because once it becomes worse, if it's fully blocked, that's where the danger comes in. Okay, however, when it starts to swell, that's where we want to quickly take care of it. All right, so that is a few emergency that relates to musculoskeletal system. All right, so next we will have our integumentary system, or generally our skin. All right, so the structure we have the epidermis, the dermis. All right, we have the fat layer as well as the fascia. Okay. So the function of it is thermoregulation to control, to regulate our body temperature, all right, for sensation, for us to feel and interact with the environment, all right, to maintain fluid, okay, as well as to protect from microbes, all right. So the problem comes will be the loss of function, okay, the loss of the integumentary system functions due to possible of wounds. All right, burns, and also possible of infection. All right, this is the integumentary system. All right, so that's about it. That's a few important human anatomy that we would normally cover in first aid. All right, of course there are more, but it's not so vital, especially at your level. All right, so now next we go into pressure points as well as bleeding. Okay, now this one all relates to wound. All right, so how do we treat for wound? All right, I'm sure that you have those who have gone through the website. Okay, they actually give you a very surface one here, which is actually doing what we call direct pressure. All right, so here I'm actually sharing with you a little bit more, okay, on what we do with a wound. All right, so the first thing we need to control the bleeding. Okay, right, which is why you learn from the website is actually what they call direct pressure. All right, so you can actually either directly use your hand, okay, or in now COVID time, you may not want to get near your patient. All right, you can ask the patient to use the other hand and then press directly onto the wound. All right, if there's any cloth or gauze, okay, that you have around you, you can actually use it. Okay, then you press directly onto the wound. All right, so if you are doing onto the patient, okay, as shown in this picture, always wear glove. Okay, however, again, like in this COVID time, we actually encourage the patient themselves to do it themselves. All right, because like all of us know, okay, we want to maintain at least 1 meter social distancing, or now we call it physical distancing. All right, so we have to maintain that distance, okay, because we do not know that patient has COVID or not. Okay, if it's your family member, okay, the risk is very low because you know your family member. All right, and then but if it's outside, in case someone is having bleeding, okay, you may want to maintain your 1 meter physical distancing, and then you can instruct the person. Okay, just tell them, okay, take your other hand, put directly onto the wound. Okay, or you can pass them a cloth or ask them if they have a handkerchief, for example. All right, but do not use tissue because we know tissue when they touch fluid, okay, water or blood, all right, it will disintegrate. So it's no point. Okay, something a bit more solid, put it directly onto the wound. Okay, now if this fails, all right, the next thing we'll actually do is actually elevation. All right, this is where you can see from the picture as well. right? We use gravity to help elevate above the heart, okay, so that it helps to reduce the blood flow to the wound. Okay, the last thing that we will do if it's still not stopping, okay, right, then we only do indirect pressure. Okay, so indirect pressure meaning we're actually trying to press onto the artery that is before the wound. So the wound is here, okay, you can see it's here. So we are actually pressing to the artery, okay, or what we call pressure points before the wound to help stop it. Okay, now sometimes long time ago, maybe Skipper Charles knows, right? We would do something what we call a tourniquet. We would actually tie a knot there. Okay, that one is very dangerous. Okay, because when you forget to untie the tourniquet, okay, or the bandage there, right, it will actually stop the whole blood, okay, to the extremities here. So instead of just stopping blood to the wound, the whole part all the way until the fingers, right, are not getting blood. All right, so then the cell will start to die. Again, that is a danger that we discourage a tourniquet. But if you want to do indirect pressure like this using your hand, it's fine because you are pressing. The longer you press, your hand will get tired. So when you get tired, automatically your brain will tell you, okay, let go. All right. So when you let go, then immediately the blood will actually go back to the limb. Okay, and with the hope that by the time you release, okay, the bleeding will have stopped. All right. So this is indirect pressure. The only other drawback about indirect pressure, okay, is not easy to find the pressure point, okay, which I will try to help to guide you over here through this webinar session. All right, but you just try your best. Like I said, if you cannot find, it's still fine, right? You just do your direct pressure and your elevation. That should be enough, which is similar to what the one that you learn from the website. Okay, indirect pressure is not to say discouraged, it's just that it's harder to do. Okay, right? But tourniquet is a no-no. Okay, do not tie anything there. Right? So now, what are the pressure points? Okay, right? Now, the pressure points, okay, if you see from this picture, there are 11 of them. All right, if you want, you can actually try to find on yourself. Okay, certain parts is easier to find, but certain parts is a little bit hard. Okay, so we have 12. We have 11 here. Okay, so the purpose of indirect pressure, okay, is to apply at different pressure points to help to constrict the artery feeding the blood to the exposed wound. All right, so now we start on the top. Okay, is the temporal. Okay, this one usually I think most of you will know. All right, when you are like having some sort of headache, you take your miyakapa, all right, and then you rub it at the temporal, and that is the place actually. Okay, there's a blood stream passing through there. Okay, this one controls the upper face here. Okay, so if there's bleeding here, okay, you can press this side. Okay, and also we can also press the other side. There's two, left and right. Okay, so this is the temporal pressure point. Okay, right. Next is the facial. Okay, if you follow your jaw, okay, if you follow your jaw here, okay, it's somewhere in the middle. All right, you just press softly onto the jawbone. You would be able to feel a little bit of pulse there. Okay, you can feel the pulse. That is where the location is. Okay, so this one controls the facial here. All right, so this is your facial pressure point. Okay, it's right here as well as the other side also. You'll be able to find. Okay, don't worry if you are unable to find. Okay, like I said, it's not easy to find, but with a bit more practice, okay, you should be able to find. Okay, and right. Next, we will have our carotid. Okay, which is actually you have your what you call that, your throat. Okay, right. It's right at the middle of your neck. It's behind your throat. All right. So if you put your two fingers there, all right, you should be able to feel your pulse. Okay, behind it. All right, it's either on the left side or on the right side. Okay, so that is your carotid pulse. Okay, or carotid pressure points. All right. Next, we go down to a bit lower. okay, your subclavian, okay. So this is where a little bit hard to find, okay, but you will be able to find it, okay, especially that's where you see those who like to, you know, when you have your stiff shoulder and all, right at the shoulder here, okay, right, you just press onto it, okay, similar to like how people do massage, that is where you press onto it, okay. So the artery is actually pretty deep, all right. So the person, if you want to try to feel the pulse there, okay, you have to relax a lot, all right, and then you have to press deep inside, then you can feel a little bit of the pulse, all right. So that is the subclavian, okay. So that actually controls the whole shoulder here, all right. Now next we will have our hands, okay, which is the brachial, all right. Brachial is actually here. This is the picture of where you press the brachial, right? Brachial here, all right. How do you find it? Okay, you can do those boys, okay, all right, like to do your muscle up here, okay, right. So you have your little mouse, okay, when you do your muscle, right, you have your little mouse, you just follow that little mouse, okay, all the way underneath, okay, until you feel your bone, okay. It's actually between the muscle and the bone, so that is the artery is there, okay, right. If you cannot find in the middle of your arm, right, you go a little bit higher, nearer to your body, okay, or your armpit, okay, you should be able to find the pressure point there. That is your brachial pressure point, all right. Again, this is not easy to find, okay, because artery is actually a very important blood vessel, all right. So it's actually protected by the muscle. That's why, like for this one, you want to find it's hidden underneath the muscle, all right, and then it's actually leaning near the bone, all right. So you have to feel until you can feel the bone. So it's actually around there, all right. So that's your brachial, all right, and then of course your radial and your ulnar, okay, at your base of your hand, your wrist there, all right. So one side, the top side near your thumb will be the ulnar side, okay, and then the bottom is your radial side, okay. This one, if you can't, not that I can't find, right, sometimes you will use two hands, okay, two thumbs, just press straight, one on the radial, one on the ulnar. So that will block the blood to the palm, okay, right. So that is your radial and your ulnar, okay, pressure points. All right, now next would be the harder one, okay, is the femoral for your legs. All right, this one, if you see from this picture itself, okay, you can see it's near the groin area, okay, but actually it's not at the groin area, all right. So if you what you call that, go to shower later today, all right, it's actually between your thigh, okay, and your body. So there's the gap there, right. So that is where you actually slide your hands in, okay, and then if you move your thigh, you will feel some muscle going there. That is roughly where the femoral pressure point is, all right, because it goes one whole bundle down to your leg, okay, right. Now next will be the polyvagal, okay. This is actually behind the knee. It's not the knee itself, all right. It's behind your knee, all right. So if you feel behind your knee, you should be able to feel the pulse there as well, right. So this is also why for us scouts, we do not, when we do our kawakaki, we do not stand straight and we lock the knee, meaning we push the knee all the way to the back and we may stand straight. When you do that, actually is indirectly is pressing onto that polyvagal blood vessel, and then that's why you don't really get much blood to your feet. Okay, so usually that's why when you stand straight, okay, your knee will be a bit flexed rather than straight and locked to the back. All right, so that is the 10th point, right? And all the way down, right, here is your tibial, all right? So this one also, there's actually one in front, one at the back, okay, which is actually near your feet, okay? If you feel your feet, okay, right at the back, okay, you will feel the what you call it, the pressure point there, okay? You will feel a little bit of a pulse there as well, okay? That is also where usually people do a little bit of massage when they have foot pain, okay? Like especially when you go on your hiking, you feel it's painful, tired and all, okay? That's where you will feel it, okay? It's very, if you see from this picture here, okay, it's actually far back near your heel. Okay, if you feel your heel, all right, there's one line holding it. Okay, one vein, like a long big ligament or vein, okay, holding it is right between that. Okay, so that is your tibial. Okay, and then actually in front there's also another one. All right, if you move your leg up and down, you feel there's actually one tendon or what is pulling it up, and that's where it's between that. All right, so your tibial one, there's one in front here, and then one right at the back near the heel here. So that is the location. All right, so these are the 11 pressure points that you can use, right, in case your direct pressure and your elevation is not helping, it's not really stopping the bleeding on the wound. Okay, so you can use these pressure points to help you slow down the bleeding. All right, so this is it's actually a very old method. Most of the time nowadays, first aid, we don't really teach this because, like I said, it's not easy to find. So we don't want newbies like all of you who just learn first aid, start to crack your head and find all these pressure points, and then you slowly give up and feeling because you couldn't find it. All right, so we actually teach you, you can do first aid, you just do your direct pressure and elevation. That will be good enough until the ambulance arrives. All right, so that is wound treatment and related to, and also your this pressure points. Okay, so that covers your second part of your lencana ahli pertolongan cemas. Okay, right, any questions so far? Right, feel free if you have any questions, you can actually type in the chat room. All right, if I'm going too fast, you let me know. All right. Okay, next we will go into shock. Okay, so what is shock? All right, so shock is actually a life-threatening condition where the circulatory system fails, right, resulting vital organs being deprived of oxygenated blood and nutrients, all right, leading to the organ damage and possible death. All right, as I mentioned earlier, okay, it's a failure of the circulatory system. Okay, and then if you remember earlier when I talk about circulatory system, there are three parts. All right, so you have your one is your blood. All right, so if there's a low blood volume, that will lead to what we call volume shock. All right, if it's a vascular tone, which is your blood vessel, all right, so that is a vascular shock. All right, and then poor cardiac output, you know, is what we call cardiogenic shock that relates to your heart itself. Okay, but in this session, we will actually cover on mainly on volume shock. All right, now so what's volume shock, or what do we do with volume shock? Okay, it's an inadequate perfusion pressure, right, due to loss of blood volume. All right, when you do not have enough blood, it will not create enough pressure. All right, and then usually due to loss of blood volume is usually what we learned earlier is due to bleeding. Okay, right, so what causes it is can be internal or external bleeding. All right, usually what we see when we see on the skin, all right, that will be actually external bleeding. Right, internal is somewhere in the internal organs. Right, it could be bleeding inside, and then the person will lead to volume shock. All right, the other thing is dehydration. All right, it could be due to sweating, right, due to diarrhea and vomiting. All right, excessive urination and prolonged fluid restriction. This one usually a lot of time it happens when we for scouts, right, when we do our campaign, when we do our hiking. Okay, like when we sweat, okay, especially Sea Scouts, we go kayaking, okay, we have prolonged fluid restriction, we don't drink a lot of water, all right, yet we are under the sun, we are sweating, all right, so that leads to dehydration, okay, if you don't take care of it, it will lead to volume shock, okay, right, so what do we do with it, okay, when we discover volume shock, all right, we stop the fluid loss, okay, all right. So like if it's bleeding, we stop it. Okay, if it's due to like sweating, right, due to fluid restriction, okay, drink more water, okay, to replenish the sweat, your fluid, all right. And then, okay, replace the fluid, okay, as I mentioned, all right, and also maintain calories and body core temperature, all right. You can give them some something sweet to drink, okay, it gives them a calorie. Right, because that's where the energy comes in. So your body needs that energy, right, to help regain, to produce more blood, to regain your your body temperature, okay, right? Because we do not want when your body temperature drops, right, that will lead to hypothermia, or when your body temperature goes high up, okay, it will go into heat exhaustion, okay, or heat stroke, right, which is we do not want. We have to maintain the body temperature, okay. Right, next we will have is actually electric shock. It's slightly different, okay. This one happens when a person comes in contact with an electrical energy source. All right, electrical energy flows through a portion of the body, right, causing a shock, right, to the body. All right, so you can see from here, this hand, this is where the electric enters. Okay, you will have seen a bit of burn here. Okay, right. So what causes it? Obviously, electric source. Okay, at home usually will be your plugs. Okay, your wire plugs. Right. That also could also be when you are outside the high voltage lines. Okay, if it's like a lightning or what, or it broke, right, and then it dropped, and then someone is underneath. That can also cause electric shock. Right, and of course, lightning itself is also a source of electricity. All right, so that can cause electric shock. Okay, so how do you know the person is having electric shock, right? So sometimes you will see burns at the point of contact, all right? So this is what you can see in the picture, all right? And possible, right, if the person has been thrown clear from the electric shocks, right? That's why sometimes when you play with electricity, you will feel your hand pull back from the electric source. Okay, when there's high voltage, usually your hand also will be, your whole body may be bounced back as well. So if you see the source at one corner, this person is lying on the other corner. All right, there may also be pain in the hand or the foot. All right, the treatment. All right, of course, number one, safety first. Okay, you do not want to be electrocuted yourself. All right, so I think in school they will tell you off the main switch. Okay, do not touch the patient first. All right, safety first. Be safe. All right, off the main switch. All right, call 999, especially if the person is unconscious. All right, and then after you off the main switch, call 999. Right, approach the victim. You can check for pulse and breathing. Okay, you need to perform. You may need to perform CPR if the person has no pulse and is not breathing. All right, you may need to. You will need to next treat for burns. All right, and treat for a shock. All right, and then send the patient to the hospital, because electricity, when it travels, it will go in. There will also be an output. Okay, there will be somewhere also the electricity will exit. The problem is you do not know where it enters and where it exits, so you may need to check the whole body. Okay, and the worst thing is if it travels to your body, your body. Okay, there are a lot of vital organs here. All right, if it passes through, especially it reaches your heart, the heart may stop. That's why number 3 there I mentioned, check for pulse and breathing. Okay, if it's lucky enough, it travels from your index finger, comes out from your pinky, you're fine. So the electricity did not pass through your whole body, so you are safe. Okay, so you are safer lah. Right, but for us, we always try to send to the patient to the hospital just in case there's internal injury that we overlook. Okay, right. So that relates to electric shock. All right. Now I have a question here. So, as said earlier, you need to off the main switch when there's a electric shock case happen. So you run to the switch box. Okay, you see this, right? There are so many switches there. So tell me, which one is the main switch? Can some of you reply in chat? Okay, which one is the main switch? All right, the blue one. Good, Sophia. But the question, there's 2 blue ones. One is a darker blue, one is a lighter blue. So which one is the blue one that you need? Okay, obviously it's not the green. Okay, red, the gray, right? So we have this lighter blue or this big darker blue. All right, I can see a lot of you answer blue one, smaller blue one. All right, and someone answering darker blue one. Okay, so which one is actually the main switch? Okay, right, let's see, let's wait for a bit more of answer. Lighter blue one. All right, what else? Okay, so now it's a debate between the lighter blue, the smaller one, and the bigger blue, darker blue one. All right, the answer is correct, it's blue, but which blue? Darker blue or lighter blue? All right, so we have lighter blue, we have darker blue, we also have lighter blue. Okay, right? Okay, now let me share with you. Okay, the correct answer is actually the darker blue. Okay, the big one. Okay, on the right. Okay, like what Skipper Charles mentioned. Okay, that is the main switch. All right. So what is this small lighter blue one? This is actually electric ELCB. Okay, electric leakage circuit breaker. All right. So whenever there's uh, the circuit, okay, when there's actually any short circuit, right, this one will trip first, right? It will break the circuit. Okay, so like just now, if the person is holding onto the electric source, right, that's where this one will trip and to help stop the current. Okay, so there should not be any current passing through. However, okay, the big one usually is still up. Okay, this is where sometimes you do not know whether the circuit breaker works or not. All right, even if it's tripped, if it came down, okay, if it comes down, all right, you also do not know whether there's electricity there or not. So always to be safe, right, pull down the big main switch as well, right? So you will have actually two of these blue, okay, down. All right, by the time when there's electric shock happen, right? If your circuit breaker or ELCB works, right, the small blue one will have come down, okay, all right, will have come down, and then when you reach there, you pull down this big blue one, all right. But sometimes if you reach the place, okay, this small blue one also didn't come down. This ELCB is not coming down, right? Then what you do is you also pull the small ELCB down and the big main switch down as well. So pull down both, right, to be safe, to ensure there's no electricity passing through. All right, so very good. Okay, the correct answer is the darker blue one, all right, not the lighter blue one. All right, the small button here, this is where you test whether this circuit breaker works or not. All right, so this one usually once a month, okay, at least, okay, you try to press this button and see whether it trips or not, it comes down or not. Okay, if it doesn't come down, that means your circuit breaker is not working. All right, and if there's any leakage around or some short circuit around, that's the danger. Right, so always check. Okay, and those of you who have water heater at home, all right, there's also a test button. Usually you will find a test button there. All right, that is also a circuit breaker there, because when you shower, all right, and you are using your hot water shower, hot water shower, there's electricity there, and then water obviously is friend to electricity, and then you're all naked there, right? You do not want to have any electricity passing through you, all right? So there's a test there, the button there, okay? You can press it and then to see whether it trips or not. Okay, when you turn on your shower, the motor will work and all. Okay, then you press the test button. If it stops, that means it saves the ELCB of the hot shower functions. Okay. However, if you press, it doesn't stop. If the machine is still working, then you better stop showering. Okay. All right. Because if there's any short circuit there, you may be electrocuted. All right. This is what one of my electrician friend told me. All right. What he always do is before he starts showering, when he turn on the switch, all right, he will test the circuit breaker. Okay, every time before he shower, he will test it out. Okay, to make sure that it works, then only go into shower. All right, so this is something you need to be careful of, those who have water heater at home. Okay, right. So next, okay, we go into the next part. Okay, this is a bit of a challenge for me to teach as well, right? But I'll be doing a little bit different this time. Okay, I hope all of you have your scarf with you. We may not be doing it what do you call that, fully using your scarf, right? But I'm going to share with you some alternatives way, okay? Because what I always see is number one, you may not have your scarf all the time. Okay, although scouts, when you are in uniform, when we are doing scouting activities, all right, we have our scarf. But when you are on school, for example, all right, or you're out at the mall, you may not have your scarf with you. So that's where I'm going to share with you a little bit different, okay, on how can you do some dressing and bandaging without your regular scarf or triangular bandage. Okay, of course, I will show you a little bit also on how to do dressing and bandages with your triangular bandage or your scarf as well. All right, but before that, what's the difference between dressing and bandages? All right, so dressings, right? Okay, dressing, what are dressings? Okay, they have 5 uses. Okay, one is to control bleeding. Okay, number 2 is to cover the wound to prevent infection. All right, number 3 is to protect from dirt. All right, number 4 is to apply medication. All right, and number 5 to encourage the wound healing process. All right, so in general, everyone would know the most general dressing that everyone knows is our plaster. Okay, of course, the rest we have is our gauze pad. Okay, the original iPad, that's why I always call it. Okay, not the Apple iPad, this is our original iPad. Okay, and of course, the wound dressing. All right, so all these are what we call dressing. Okay, is to control the bleeding, right, to cover the wound and to prevent infection, right, to protect from dirt. Okay, right, to apply medication, especially when we use a gauze pad, all right, and to encourage the wound healing process. Okay, right, these are all dressings. All right, what about bandages? All right, bandages, all right, the use is number 1 to control bleeding as well. All right, so you can see here. All right, number 2 to hold the dressing in place. All right, if you do not have your tape, okay, you can actually use bandages to hold the dressing in place. So you see here, this one is the bandage, this one is the dressing. All right, now is to also provide support to the limb. Okay, this is where most of us scouts we learn our bandages. Okay, especially when if you have covered your usaha and your maju badge, you have learned some bandages already, right? That's why this session I'm assuming you know more or less, right? But I'll share with you a little bit different. How do you improvise? Okay, and also to help reduce swelling. Okay, right? So when you wrap your roller bandage here, okay, you will limit the area for the swelling to happen. So that's where it will help to reduce swelling. Okay, it also restrict movement. Okay, especially when you have a sprain. All right, when you tie your this roller bandage here, okay, or use your triangular bandage there, right? It can help to restrict certain movements. All right. Our common bandages would be number 1, our triangular bandage, and of course, number 2 is our roller bandages. Okay, all right. So these are the difference between dressing and bandages. Okay, right. Next. Okay, so let's do a little bit of bandaging. All right. So I think most of you know. Okay, this is what we call an arm sling. Okay, and if I assume all of you who have done your lencana usaha, you will have know roughly how to tie this. Okay, otherwise I'll be sharing with you shortly. Okay, a video. All right, because for me to show on myself is not easy for you to understand. All right, I will be showing you a video on how to do an arm sling and also how to do an elevation sling. Okay, so let me exit this and then I'll play the video for you. All right, all of you can see this. Okay, so this is a quick video on how to make a sling, all right, from St. John Ambulance in the UK. All right. You all can hear the sound.
You should use a sling to stop someone's arm moving, to protect it and prevent further damage. There are two types of sling, an arm sling and an elevation sling, and both can be made using the triangular bandage. The difference between these two types of sling is that an arm sling holds the arm in a horizontal or slightly raised position. It treats upper arm injuries, wrist injuries, somebody who can bend their elbow, and also for a rib fracture. An elevation sling holds the arm in a raised position with the fingertips touching the shoulder. It can help support the arm. It can also help control bleeding from the hand or the arm and also help to reduce swelling. To make an arm sling, ask the casualty to support their arm. Just hold it for me. And then use your triangular bandage and gently pass it underneath their arm and over their shoulder. And leave the long bit facing down. Then bring the top bit around to the opposite shoulder, and the bit that's hanging down, bring that up to beat it. And then re-support it. Lovely. Just tie a reef knot. And then tuck the corners underneath. And make sure the whole of the arm is supported, down to the little finger. With the bit that's left over, just twist it until it becomes nice and tight and it snugly fits in around the elbow. To make an elevation sling, first ask the casualty to support their injured arm. So just touch it there for me, and their fingertips should be touching the shoulder. Lay your triangular bandage over the injured arm. Just get the casualty to hold it in place. Just hold it there for me. Come underneath the arm, around the back, and then tie using a reef knot. And then just tuck the points under. With the bit that's left over, just twist it until it's nice and tight and it fits snugly in by the elbow. To check circulation, you need to squeeze the fingernail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the sling is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, there are two types of sling. You need to know which one to use for each condition and how to apply them.
All right. So from this video, you can actually see how to tie your arm sling, as well as how to do your elevation sling. All right. So I'll be sharing this link in the group. Right. So for you who want to learn more, okay, or want to review the video. All right. So Sophia, you have a question. Here, what is ELCB? All right, ELCB is electric leakage circuit breaker. All right, electric leakage circuit breaker. All right, so if it detects there's a what you call that, leakage in the circuit. All right, so it will break the circuit. All right. Right. Okay. Now. Okay, I won't be sharing the screen. Okay, so all right. So now I think all of you can see my video. Okay. Now, just now is how to tie your arm sling and elevation sling, right? So now I'm going to share with you a little bit on what if you do not have your scarf, okay, or you do not have your triangular bandage with you, right? So how do you do arm sling, or how do you do an elevation sling? All right, so one of the easier method, okay, that you can do, okay, that's why I'm actually wearing this uniform today, and actually purposely I'm wearing a long sleeve to show you, to demonstrate to you how to do all this. All right, so number one, all right, when those wearing a long sleeve, okay, they will usually have this button here. All right, one of the things you can do, actually you can unbutton either the top, the highest button here, okay, right? You replace, you take this button, all right, and then you hook onto this hole, all right? That's how you can do a arm sling. All right. So for example here, I just hook onto this. All right. So it's already hooked here. So this is, all right. This is my simple arm sling. All right. Okay. Of course, another method, okay, you can do, all right, is to just the gap here. All right. Put the whole arm inside. Okay. Whichever comfortable. If it's too high, all right, you can actually button one more button. Okay. Go a little bit lower, so it become a 90 degrees more comfortable for the patient. Okay. Of course, if you want elevation sling, okay, another thing similarly, right, this button, okay, like our scout uniform, we have another button up here, all right, you can actually use this, okay, the hole, and then you hook it up here, so it become a elevation sling. So it elevates and it holds up this portion. Okay, so this is the two options that you can actually do with long sleeves. Okay, right. Now, what about those with t-shirts? All right, what do you do those with t-shirt? Okay, sorry, before that, right? Another option, okay, if they are wearing shirt, okay, if all of them are wearing shirt but not long sleeve, okay, like usually most of us now, okay, or like backup boys, okay, you are wearing short sleeve. You are wearing a shirt, but you're having short sleeve. You do not have this to do it, okay? Or even like for ladies, you are having, you are wearing your baju kurung, okay? You also do not have the button here, all right? So of course, what you can do, similar idea, okay? Right? You just take the sleeve, okay? For baju kurung, you take the sleeve, you take your safety pin. That's why in your first aid kit, there's a safety pin there, all right? You need a safety pin there, right? That's where you can pin onto the shirt itself. All right, that's where one way you can do those with long sleeve. All right, now back to those without long sleeve. Okay, what can you do? All right, and the person is wearing a shirt. Okay, so I'm going to demonstrate a little bit. All right, I'm going to take a step back and show you. Okay, right. Now, what you can do is, all right, you have this shirt. Okay, you need to untuck. Right, you need to get the person to untuck the shirt. Okay, I think I'm going to take off my scarf, right? Otherwise, you won't be able to see properly. All right, sorry for undressing in front of all of you. All right, so now what you can do here, all right, you have this. All right, so what you can do, you can unbutton the lowest button. Okay, some shirt they have some spare button at the back, which is very, very helpful. All right, however, for here, if you do not have the spare button, what you can do is take the lowest button. All right, this is the injured arm. Right, then what you do, fold it up, same concept, use this button, all right, button at the highest button of that shirt. All right, right, so it will be something in this manner. Right, so I have button up here. All right, I use the lowest button, I fold it up. Okay, here I just give it a nice support. Okay, like how you can see here. If you want, you can tuck it in. Okay, you can tuck it in. All right, so this is your arm sling. Okay, that you can use. All right, so this is one method. Okay, right, that you can do. All right, now those with short sleeve that you do not have a button for you to do this, you can do this method. Okay, it's more comfortable. All right, of course, another option, like I said, right, instead of having this, okay, what you can do is just put between the, okay, you open up the button here.
Skip Chan, we can't hear you. Sorry. Someone mute your mic as well.
All right, okay. Right, so give me a short moment. Okay, I'm going to take out this. I'm going to show you for t-shirts. Okay, what do you do? Because you don't have all these buttons to help you. All right, just a moment. All right. Now, what about those who have t-shirts, you don't have button for you to slide the hands in, right? You can use a similar concept. You want to do a arm sling, okay? So you just untuck, right? Untuck here, okay? And then similarly, right, put the hand, okay? And then lift it up, okay? This is where you need your safety pin here, right? You need your safety pin to pin it up, to hold it up, all right? So this is one method, okay? What about elevation sling? Okay, an elevation sling, this one is a little bit tricky, okay? You need to get the person to put this hand in, all right? Say this is the injured arm, all right? You put this hand in, all right? So you'll be in this manner, all right? This hand goes in, okay? This hand comes here, same method, okay? It goes underneath, all right? All right? Instead of here, it goes all the way up to the shoulder. So you can see here, it gives me the elevation. All right, so this elevation sling, all right, you need to put the hand in. All right, if it's normal, you can just put here, add the safety pin and hold. All right, so that will be your two sling, okay, with the arm sling and elevation sling without using any of your triangle bandage, okay, or your scalp scars. All right, now I'm going to get something, okay, to demonstrate to you the next thing that you can do. All right, is what we call collar and cuff method. Okay, just a moment. Okay, right, I'm back. Okay, now this is another method that we can use or we can do, all right, which I believe most of you, especially in school, you will find is your tie. Okay, your tie. All right, now alternatively, let me show you quickly on the slide. Okay, what I'm trying to do is this one, what we call collar and cuff sling. Okay, this one is usually, all right, you have, for example, injury here that you do not want to cover like this. All right, so you do here, or you may have a wrist injury a little bit, you want to support the wrist and then just go around the neck. All right, so how do you do this, what we call collar and cuff sling? All right, so let me exit. All right. Okay, so how do you do that? Okay, of course, number one, okay, I'm going to demonstrate to you in two things, okay, using your normal triangular bandage and using a tie, okay, that you may have at school, okay, you'll be using. All right, so number one, okay, I will share with you this first, okay, because sometimes it's not only a tie you may have just a scarf, okay, along those square scarf, you need to fold it into this width. All right, so how do you do this? Okay, let me just explain in terms of using your scarf, okay, as a triangle bandage. All right, okay, now this is where you can actually take off your scarf and then you can do it together with me. All right, now number one, okay, your triangular bandage, okay, you have one long underneath here, and then these two sides is the same length. Okay, this is how you position it. So what you do is the top, let it go underneath, okay, touching the base. All right, this is the first fold. All right, next, okay, do it again, repeat again. All right, top to the bottom. All right, so this is your second fold. This is what we call a broad bandage. Okay, a broad bandage. All right, this one usually when we do where we use this broad bandage, okay, on almost the size of your palm, okay, your palm, right, is for your knee and above. All right, so from your knee, including your knee, anything above your knee, you need to use a broad bandage. Okay, otherwise it's too small to hold, all right, and it's not giving enough pressure onto it. All right, so that is a broad bandage. All right, number three is the third step, you fold again, all right, from the top here, you fold it down again. This is where it becomes your narrow bandage, right, which is a bit the size of your palm without your fingers. Right, the size of your palm without your fingers. All right, this is your narrow bandage. All right, narrow bandage we use to tie anything on your arm. All right, and then below your knee. Okay, as well as your head here. These are smaller. All right, you do not need a broad bandage. Okay, to cover because it's too big. All right, like here you cover it, it's not giving good support. All right, so if it's narrower, it's better. Okay, however, on your body, you will need the big, all right, broad bandage to cover and to give a good hold here. Okay, right? So this is the size that you will want, okay, as a narrow bandage. Okay, so now how do you do this? Okay, right? I'm going to show you an arm. Sorry, not my arm. Okay, what you're going to do is, okay, you are going to tie what scouts will call it simple manok, okay, on near the wrist here. Simple manok, okay, right? So what you're going to do, okay, you will have this, okay, all right, one long, one short, all right, near the arm here. Okay, one long, you can see this is the short end, all right, this is the longer end, all right, the longer end, one long, one short. So what you do next is, all right, the long one, you flip one round, okay, flip one more round. So there will be actually 3 rounds around the arm, okay, 3 rounds around the arm. Next, what you do is leave the middle one, right? This one a little bit hard for you to do yourself, right? But you know the concept is simple manok. That's exactly what we are trying to tie, all right? But this is a slightly different method, all right? So you leave the middle one, you take this one at the base, okay, you put it through, okay, and then this one from the top, you also put it through the one at the middle, okay, and then you slowly tighten it a little bit, okay, and then put it near the wrist, all right. Right, so those of you who are good with your knots, you will be able to see this is actually your simple manok. Okay, you can also tie like how you tie your simple manok. Okay, you do a round, okay, an X, and then you pass under the X. It's fine. All right, but this is how first aid we do. Okay, right. So with this, then the next thing you do is bring it around the person's neck, and then you tie your buku sila. All right, so this is your collar and cuff. This is your collar, this is the cuff. Okay, collar and cuff, right, using a triangular bandage or any other bandage look like, or your scarves. Okay, now next is a similar thing. I'm going to demonstrate here using your tie. All right, that's why I say it's similar to about the width of your tapak tangan without your fingers. All right, this is nice length. This length we don't really want near the arm, okay, because it's too small. All right, and it's going to constrict the blood circulation. All right, so what we do is we want this area to be wrapping around. Okay, so here I'm going to demonstrate a slightly different approach, like how scouts you all tie your simple manok. Okay, you do one round, you have your X here. All right, you do the other round, you let it pass through the X. Right, so this is your simple manok. Okay, right, now have the X portion up here. All right, so at the base here you have your, this is your 2 lines. Okay, you have 2 lines here. All right, the X is all up here. All right, do not go this underneath here. No, this is not good enough. All right, and you are actually adding additional tension here. Okay, we need these 2 up. All right, so all your knots is up here. Okay, and then down here is flat. All right, so same thing like just now. What you do is having this, go around the neck. Okay, and then you tie your buku sila. All right, I'm assuming all of you pass your kalian, you will have know your buku sila. All right, if not, look for your scoutmaster and learn again your buku sila. So this is your, right, this is your collar and cuff. Right, using your screw tie. All right, so this is one other option you can do if you do not have a big cloth. All right, if the person, like for example a female, you do not want to do like what I did like this. All right, you can use the tie just to tie like this. Okay, so this is another option that you can use. Okay, right. Let me undo this. Okay, next we will go into our next bandaging, which is the head bandage. All right, I think this is quite common. All right, and most of you will have roughly learned how to tie your head bandage. All right, technically, there's a few things to look into. All right, however, in this session, I will be sharing with you certain points that you can check. All right, but of course, I'm assuming that you get your siblings in, all right, or your parents, all right, for you to try and tie the head bandage, okay, and not doing like how I'm doing shortly on tying onto myself, okay, because tying onto myself is different than tying onto someone. All right, so I'm going to get a mannequin, okay, to help me to pretend to have the head, all right, for me to tie the head bandage for you to see, okay. Right, okay, back here. Right, so back here, let me pinjam my most trustworthy mannequin. Okay, right, so assuming this is, let me go a little bit lower. Right, assuming this is your patient, all right, you always get the patient to sit down, all right, and then you stand behind the patient. All right, not all your patients have hair, right, but assuming there's a hair here, right, so what you need to do, open up your triangular bandage. Okay, you have, like I said, there's one part that is the longest, all right, you need to hold that part, the longest part, all right, and then what you do is you fold here a little bit, all right, you fold it a little bit. You do not want to have this portion, okay, touching the forehead, okay, it's going to be a bit painful, right, so when you fold it a little bit, you give a bit of cushion, right, then what you do is, okay, from the back, okay, come to the front, right? Here you can't really see this guy's eyebrow, but this is it. Okay, so you do above, covering above the eyebrow. Okay, next thing you do, pull to the back. All right, do not cover the ears. All right, do not press like this. Okay, it's going to be painful at the ears. All right, so right above the ears. Okay, and then right, you go to the back. All right, now all of you, what you can do is, okay, what you do, you try to feel your head. All right, when you try to feel your head, all right, at the back here, there's actually a loop in. Okay, this is where we want to cross. Here, this is the loop in. This is where we want to do. Okay, you don't want to cross up here, you want to cross down here. Right? So I repeat again here, from the right above the eyebrow, goes to the back, above the ears, do not cover the ears. Okay, then cross right at the loop, like I said. Okay, cross only, do not tie. Okay, so you're going to cross the bandage, okay, left and right. Okay, so you have this, right, you're going to cross left and right. Okay, now if your bandage is long enough, that's where you can come in front, right, but usually your scarf is shorter, right, that's where you will actually just tie at the back here. All right, most of you, I know, if you have your scarf short, all right, you just tie at the back here. All right, right at the back, you tie your buku sila. All right, but normally if you are having a normal triangular bandage, that's where you can actually go all the way in front and give it a good, proper tying. Okay, because like you can see, all right, our head is round. Right, the more you tie, like just now I started at the eyebrow, now it has already moved up. That's why when you have this coming back in front, right, and then tying here, tying your knot here, putting it pressure so that it holds. It doesn't go too high up. Okay, and then why I say you must have that below the loop here. Okay, again, for it not to come up. All right, so if it's long enough, then go back in front and tie it up with your buku sila. Okay, tuck it in as usual. All right, and then here, if you can, all right, don't leave a mess like this. Okay, press the top here. This is the the other end, okay, you try to tighten it. You can see all these are tightening in. All right. After tightening in, then only you slowly, okay, all right, you can fold it in, okay, you can fold it in, all right, and then towards the end, you can tuck in at the place where you crisscross, all right. So that is your head bandage, all right. That is your head bandage, right. To test whether it's functioning properly or not, that's why you try to pull here a little bit, okay. It should be nice and tight. All right, that's why if you have this additional coming in front, it will be very, very nice. Okay, however, you do not have enough. That's why when you tie at the back here, it has to be a little bit tighter, right? So that this one doesn't move. Okay, because like I said, your head is round. If you do not anchor it here, you do not have this. Okay, it can easily just slip out. Okay, right? So this is your head bandage. All right, so a few points. All right, a few points to remember. Right, start above the eyebrow. Okay, like if the person is wearing spectacles like me, right, make sure you take it off. Okay, because when you tie, you'll be covering the spectacles here. It's going to be painful as well. All right, take it off. All right, start it off above the eyebrow. Okay, like I just demonstrate a little bit again. All right, fold your triangle bandage, the long end. All right, come from the back. Right in front, right above your patient's eyebrow, okay, and then do not cover. Second point is do not cover the ears, all right, above the ears, all right, and then you go all the way to the back, all right, where there's a curve in. That's where you need to anchor it down there, all right. So you will just crisscross left and right, and then go in front here, and then you do your buku sila. Okay, always continue to maintain a bit of tension, a bit of pressure, okay, but not too tight until the person starts to feel dizzy or headache. All right, then you end your buku sila. All these extras, right, tuck it in. Okay, and then here, press the top here, the back, like make it neat, all right, push it down, right, then only you fold. Right, all this you can tuck at the where you have your folds. Right, you can tuck it. If you have safety pin, you can actually also put up here, and then you put a safety pin up here. All right. For me, we usually do not encourage having safety pin. All right, because you open a safety pin, you may accidentally poke the person. Right, so you may have to put up a little bit and then push it through. Right, that's why usually we don't teach safety pin. You just ask to fold and then you tuck it in. All right, so that's your head bandage. All right, so I hope all of you get to practice a little bit. Okay, I think all of you off your camera, maybe a bit shy in front of me. All right, but it's all right. Okay, you can. This video is recorded. Right, it will be shared. All right, so you can actually review it again and again. All right, if you have more questions or you want to let me check, you can actually use this same group. Okay, take a picture of you done doing this, and then let me check whether you do it correctly or not. Okay, one way to test, all right, is you do here, you actually try to pull it up a little bit. Okay, not too strong, for sure it will come out. I just use small pressure. If you see, all right, it's not moving. That is a good head bandage. All right. Okay. Now, one last one. Okay, which we will normally cover. Okay, which is your palm. Okay, how do we bandage your palm? Okay, right? How do you do that? Okay, generally again your triangular bandage, right? But if you do not have a triangular bandage, it's a square bandage, is still fine, right? The principle is the same, all right? So now for the palm, there's actually two methods, okay, to do for the palm. Okay, it's not to say on the methods, more on the reasoning behind it. Okay, now your palm, okay, your palm sometimes or most of the time the cut will be horizontal like this. Okay, the cut will be horizontal like this. Okay, so if it's horizontal like this, okay, right, the cut is like that. Okay, what we want to do is we want the person to have the hand grip like this. Why? Okay, when you grip like this, if you can see your palm's muscle, okay, the skin is actually helping to push the wound close. Okay, so that also helps in bleeding. All right, so you want the person to grip like this. Okay, most of the time you see how to tie your palm. Okay, in your Google or in scout books, they will show the palm as open. Right. That is one method. This is the other one is when the wound is horizontal, you need to grip. Method is still the same, how to tie, but the positioning of the hand, you need to grip. Okay. Now, if the wound is like this, okay, for example, you run, you fall down, right? So you have the wound straight like that. All right. This is where you need the palm to be flat. Okay, this is where you need the palm to be flat. All right. But if you are like those playing with parang or what is or taekwondo, right? Martial art, they take a knife, all right, you are holding, then you get the cut horizontal, all right? So the cut is horizontal, then you need the hand to grip, okay? Right, so this is the two slightly different approach where the palm is flat or the palm is closed up, all right? Now, I'm going to show you the same method, okay? I'm going to turn my video down, all right, so that you can see how to tie the palm, okay? Right? All right, so welcome back, my trusty hand. Okay, my trusty assistant's hand. All right, so this is the hand. Okay, right. So before you put the hand here, right, you get ready your triangular bandage. Okay, so what you do is, right, the long end is the long end is down here near the person. All right, the other top is further up. Okay. Right, so what we're going to do, all right, so again, the base here, you fold it a little bit, okay, you fold it a little bit, okay, then you put the person's palm like this. This is scenario number 2, okay, where the cut is straight, okay, where the cut is straight here, all right, so you need the palm to be flat, okay, not folded, okay, so flat, so what you do is, when I cut like that, so the hand has to be flat down. Okay, you want the hand to maintain open. Right? So what you do, okay, put the palm down, okay, facing down, and you bring the top, okay, you bring the top, cover it. Okay, next thing you do, all right, bring this left, okay, and then right. Okay, crisscross left and right. Okay, next you go under, all right, underneath near the wrist. Okay, go underneath near the wrist. Okay, crisscross, do not tie, all right, and then come back up here. Then only you tie your buku sealer up here. Okay, right, and then this one again you fold. Right, remember here you have your top, usually is longer. All right, that's where you can actually fold and tuck it in. Right, so this is where the palm is flat. Okay, and then you can see here you have this tool. This is where the crisscross is trying to pull the finger straight. Okay, because you want to, the cut is like that, you want to maintain it straight because you do not want it to bend. When it bends, the wound will actually open up. Okay, the wound will actually open up, okay, if it bends. So you want it to be flat and straight. All right, so you need to have these two to put it here. Okay, now the next thing about here, when you crisscross, right, so if you look at your palm, okay, you can see this gap here, okay, the curve here, right? So this is where you do not want to crisscross here. Okay, when you crisscross your knot, right, here, we are going to press onto the vein here, right? So we're going to crisscross slightly above here, so it gives a bit of gap and it doesn't touch here. So your crisscross will be up here. All right, this is where your crisscross is going to be. All right, you can't see from here, all right, but this is where my crisscross is going to be, is here. All right, it's not on here. All right, so one part of it is up here, so it creates a bit of gap, and then I'm not pressing onto the artery here. All right, so this is method number 1. Right, the other method whereby the hand needs to close. Okay, the hand needs to close. Right, same approach. The only thing the starting is different. Okay, the starting is a little bit different, right? Because you want to maintain the hand to be closed, right? So what you do is, okay, when there's a wound here, horizontal, just now is vertical. All right, vertical, you put the palm down. All right, if it's horizontal, all right, then for example here horizontal, you put a gauze, get the person to grip. All right, so this one will help to stop the bleeding. All right, you get the person to grip, but the person won't be able to grip for so long. That's why you need your bandage come in. All right, so same method. Okay, the base, the long one is down here. The top, all right, is way up there. All right, so now here, right, instead of just now the starting was palm down, that is for straight. Okay, now it's horizontal. Horizontal, the palm will be facing upwards. Right, so that's the two difference. Horizontal, palms outwards. Vertical, palm downward. All right, so remember the difference. All right, again, horizontal, palm upward. Vertical, palm downward. Okay, so same thing. What I'm going to do here is going to be like this. Okay, I'm going to bring in my trusty hand. Right, so he's going to hold like this. So you can see, right, this is the fake hand. It will open up. Right, that is where, okay, when he grip, right, when he grip, this is where the bandage comes in to help. Right, here again at the beginning, always remember, have a bit of fold here, right, so it's not too tight or not too painful for the victim. Okay, so then you put the palm, all right, and then the top, okay, pull and cover. Right, so when you see I hold and cover, okay, this side helps to control the fingers, and again I crisscross left and right. Okay, I'm going to crisscross left and right. You can see the fingers here is helping it to close. Right, so crisscross left and right, and again I'm going to go underneath the wrist, okay, behind the wrist, and come back in front. Okay, and then you tie up here your buku sealer. Now again, like I said, this is a little bit more dangerous. You need to tie your buku sealer right here, not onto this, because when you tie tight, okay, it's going to press here. So you need to tie the buku sealer up here. Your buku sealer need to be up here, not down here. All right. So your first knot is actually up here. The hand grip, okay. This knot needs to be here, not here. Okay. All right. So you tie it up, finish up your buku sealer. Okay. Same thing. Tuck it in. You have your top. All right. Fold and you tuck it in. Alright, so down here, this is where here. Alright, so your knot is onto up here, this one, okay, on your palm, not on the wrist, so that blood can still go through the hand. Alright, so this is your hand or palm bandage. Okay, so the two difference, one is palm flat, one is palm fold. Flat, down, okay, it is fold horizontal, palm up, then only you fold it in. Okay, right, so that's bandaging for you. Okay, simple bandaging for you. Alright, so for those who have done your usaha, take it as a refresher. Okay, and probably maybe you will learn a little bit more. Okay, between the palm flat and then the palm as a fist. Alright, now, okay, any questions for bandaging? Okay, right, we have another 20 more minutes. Okay, a little bit more to go. All right, okay, if there's no questions, let's proceed. All right, with a little bit of fracture and splinting. All right, in your buku scheme, we only talk about patah tulang selangka, your fracture of clavicle. All right, I'm going to cover a little bit more in general, in terms of general fracture lah. Okay, in terms of splinting as well. All right, and I'll cover this in a short while, and then we will go into CPR. All right, so what are the causes of fracture? All right, there are generally two. Okay, right, one is direct force, which is where you hit, that is where the fracture happens. All right, but what we are actually afraid is actually the next one is what we call indirect pressure, indirect force. Meaning you fall down, you hit here, it didn't fracture here, but the force travel up your bone, all right, and that's where you can happen and break your clavicle, your tulang selangka, all right. Okay, so this is indirect force, all right. Similarly, those who do high jump, all right, same thing. If you land, okay, your teacher will always ask you to bend your knee, all right, and not stand straight. All right, this is where same thing, right? Your legs here, all right. If there's a high force, you go the force will travel up your leg, and then it will break your pelvis. Okay, so that's the danger. So when you bend your knee, all right, the force will stop there. Okay, you break the force, and the most you may have is a dislocated knee. Okay, or the arm here you may have a dislocated elbow. Right, so that's the slight difference there, and then that's the danger there. Alright, because the force comes in here, there's no fracture here, but you need to find there may be a fracture up here. Alright, so that's a cause. Right, we have two types of fracture. Alright, most of the time it's all closed fracture. Alright, that you cannot see is under the skin. Right, that's why, like I said just now, we don't have X-ray eyes. We cannot see this is fracture, or if it's fracture near the joints, okay, we do not know that is sprain also. Okay, right. However, open wound, right, this open fracture is where the bone fracture, okay, and then it's sharp and it cuts through all the muscle, the skin, and then you have the bone protruding out. All right, so this is what we call open fracture. This one will be more clear cut, you know, it's a fracture because you can see the bone. Okay, right. So next is a bit of a picture on how do you know, okay, that is a fracture. Right, so this one you can see here, a closed fracture. Alright, like you say, it's quite normal. You can't see any bleeding and all, but you can see the hand is actually crooked a little bit here. Alright, so the suspect the fracture is here. And then when we take X-ray, so this is where you can see this is closed fracture. Alright, so another picture, this would be open fracture. Like I said, there will be bone protruding, so the bone is actually protruding out from the skin. So this is an open fracture, and obviously in the real scene you won't be able to see it so clean without blood. Alright, this is after they clean and then the blood has clotted, right, then you can see the bone. Right, but in real scenario you'll be full with blood all around. Alright, so how do you know there could be a fracture? Alright, obviously there will be pain. Okay, obviously there will be pain. Alright, the person will feel very painful. And then there will be swelling. Okay, there will be swelling there. Alright, and then there may be deformity. Alright, you can see it's not straight, there is deformed. Alright, and of course, you may have difficulty in moving normally. Alright, like you can see here in this picture. Alright, when you sit down, okay, right, normally your leg, your base of your leg will be actually lifted up here. Alright, you don't believe me, you can try later. You sit on the floor, alright, you do not have any fracture. Normally your leg, alright, your foot will be lifted up from the ground. Okay, but if there's a fracture, you can see here, there's no power there. Okay, and then it's all resting on the floor. So you can see here, this is a telltale sign that is probably some fracture here. Okay, right, and of course, if it's a closed fracture, all right, you may have hemorrhage. Okay, like you learned earlier in terms of wound, all right, there will be blood vessel near your bone. If you fracture and then it cuts the blood vessel, this is where you will see bleeding under the skin coming out. All right, so this is also a telltale to tell you that it could be a fracture there. All right, of course for open fracture, all right, you will see the bone protruding out. Okay, so these are the signs and symptoms of fracture. All right, so what do you do with fracture? Okay, you do a very simple acronym for you to remember. Is what we call a DRI. All right, so D stands for don't move, R stands for rest, and I immobilize. Okay, so what you need to do is ask the casualty not to move, all right, and rest the casualty. All right, obviously you do not want him to run up and down with a fracture. All right, it will be painful. All right, if there's any external bleeding, okay, like the open fracture, all right, stop the external bleeding. All right, immobilize with splint and bandages. All right, okay, like for example, you can see this whole leg here. All right, the fracture could be up here or it could be down here. Okay, I'm not sure because it's all wrapped up. All right, but we are locking. Okay, like there's a fracture here at the shin bone. Okay, tulang betis. All right, so one of the moving part will be your ankle. So you need to lock here the ankle. All right, and then your knee, the patient knee also can move. So you need to lock at the knee. All right, and then of course, all right, above and below the fracture. Okay, because the fracture is broken. Okay, the bone is broken. Right, above and below it can still move. All right, so at least you will need 4 bandages. All right, so assuming okay the fracture is here, you need to lock the ankle, you need to lock the knee, don't let it move, you need to lock above and then below the fracture. The fracture is here. Okay, so that is the immobilization. All right, you elevate the injured area, okay, to help reduce swelling, and also if there's bleeding, also help to reduce the bleeding. All right, and of course you need to bring the casualty to the hospital. Okay, now before I go to CPR, okay, so back to what you need to learn in your lencana ahli pertolongan cemas, okay, which is actually you need to know how to do fracture treatment for clavicle fracture, your tulang selangka patah. Okay, so tulang selangka, what you would do is what we call elevation sling. Okay, so you learn from the video just now, okay, how to do an elevation sling with your triangle bandage, and also I've also shown you how to do a sling just with a normal shirt. Okay, right, so what additional thing you need to do, okay, if there is a fracture here, okay, you will need to do your elevation sling. Okay, you do your sling ready, okay, like for example, probably what I'm doing here, okay, all right, so I've done my elevation sling, all right, and then here the problem is my elbow can still move, you can see, okay, it's only holding my hand so that because this is fracture, you will drop, okay, so it's just holding it up, all right, but I can still move, all right, as you know, when you move, all right, your hand will swing front and back, so you do not want that, right? So the treatment, how do you do, how do you stop this from moving? So you need to add a swab, okay, you need a broad bandage, okay, like I showed you earlier, okay, you have a bandage, this is narrow, okay, just your palm without fingers, all right, so you need to open it up, okay, you need to be broad because this is above your knee, so you need a broad bandage, okay, so you lock over here, okay, where the elbow is, okay, the elbow here, you go all the way in front, okay, and go like this, you need to lock here, okay, tie the knot here, right, so you can see with this, I can't really move, all right, so you tie the knot under my armpit, but not right under, just a little bit in front, okay, because if not, my hand will swing, and then you will rub against the knot, right, so what you do, right, just add, you do your elevation sling, just add a swab, okay, a broad sling, okay, right, around the elbow, okay, lock around the elbow, right, tie here, okay, so this is how you treat for fracture of the collarbone, all right, or clavicle we call it. All right, I think I see a question. Why only broad bandage? okay, above the knee. Why not below the knee? Okay, as I mentioned earlier, all right, when you see broad, okay, all right, like you see, the hand, if I do a broad, okay, if I do a broad, it's giving too big of a surface. All right, if I do a narrow, it's nicer, okay, and then when I tie, it's easier. Like for example, here I want to tie at the wrist, okay, I do a narrow, I just cross left and right, okay, and can do, okay, right, but if I'm using a broad, either at my arm or below the knee, okay, near my foot, okay, it will be too big, all right, I can't really do a nice job of tying this, and it's not giving enough pressure. Okay, you can see like I do a crisscross here, you can see here there's a gap. Alright, because when I pull, the force is up here, it's not down here. Right, if I'm using a narrow bandage, okay, when I pull, okay, I do a crisscross. Alright, you can see the pressure is just nice where I wanted it. There's not much of a gap. Okay, right? So that is where for narrow bandage, same thing. Okay, just to show you. Okay, so knee, below the knee, all right, we have a narrow bandage here. Okay, if I have a ankle, all right, I sprain my ankle. So same thing, I do a narrow. So you can see, just nice at the foot of my, at the middle of my foot, I do the crisscross. Okay, and then I go behind and I tie it up. So you see, give a nice secure bandage. Okay, compared to a broad bandage, it's too big, it's too wide. All right, when I do this, you see it's too wide, and then when I cross, it's right, it's opening too big. So there's force. Okay, when I pull tight, there's force here, there's force here. Okay, it's not at the place that I want it to be. Right, and it's narrow, I want it to be here. Right now I have force here, there's no force here. So I have to tighten here. If I tighten here, it's not tight enough because again it's too broad. Alright, so that's the reason. Right, below the knee, okay, not including the knee, below the knee is narrow, okay, and our arm, alright, is narrow, okay, and of course the head here, you want to do your bandage like all those Indians or what, okay, this is also narrow. Alright, so you have an injury up here, put a padding here, you do your narrow, use your narrow bandage here. Alright, so I hope I answer your question. Alright, so back to my slide. Okay, so the last part, okay, is already 4:20. Alright, I will try to finish up as soon as I can. Alright, the last part will be on CPR. Alright, let me share the screen. Alright, so CPR stands for cardiopulmonary resuscitation. Right, cardio means it relates to the heart. Right, pulmonary relates to the lungs. Alright, resuscitation, we try to resuscitate the heart and the lungs. Okay, so that's the base general idea of CPR. Right, however, today I'm going to share with you a slightly different approach because again, it's COVID time. Alright, we may not want to do mouth to mouth. Okay, right, so we'll be doing a little bit different of CPR, and then same thing also, this is also what we teach to laymen, okay, meaning you are not attending a proper first aid course where we are doing face to face, where you have mannequins to practice, so we will use this other approach. Alright, so cardiopulmonary resuscitation, alright, when do we need to do CPR, okay, in what scenario? Okay, obviously when there's no breathing, there's no pulse. But what caused that to happen? Okay, so there will be possible of heart attack. Okay, if you see the person drown, you pull the person from the water. Right, so you may need to prepare for CPR. And earlier you learn about electric shock. Okay, especially if the electricity passed to the body. Right, it may need you to perform CPR. Right, injuries to the head and the chest. Okay, this one usually will be a car crash, or those of you who do martial art. Right, this is where if you learn martial art, they will say no kicking to the chest, all right, or no hard kick to the head, all right, because it will lead to the person unable to breathe, or probably you may interfere with the heart function, all right. So that is injuries to the head or the chest, all right, and of course choking, okay, meaning there's no unable to breathe in, okay, stroke, which is bleeding to the in the brain, okay, or there is blockage to the blood vessel in the brain, okay, that means the brain cell is not getting enough oxygen, so it may go into stroke, all right, and then severe allergic reaction, okay, which it may be bee sting, it may be peanuts that they ate, okay, severe reaction, the person's heart cannot breathe, right, that you need to prepare for CPR, right, and of course drug overdose, all right, they take too much of drug, all right, you go into shock, the body go into shock, and then the heart may stop, the lung may stop. Right, so these are some scenarios that you may need to prepare yourself to do CPR. All right, so in CPR, okay, you need to learn about what we call chain of survival. It's a link of a chain, all right, not for you to hit people with, right, but it's a link to see how this person going to survive. All right, so the first part of the link is actually what we call early access. So once you see a scenario where you need to do CPR, or once you see the person is not breathing, okay, cannot breathe, all right, is not breathing, and then there's no pulse, all right, you need to get help as soon as you can, all right. So as early as you get help, you call 999. The faster the ambulance come, the faster they bring the patient to the hospital, the higher chance of survival the person will get. All right. The next thing is the next in the link is early CPR. As early as you can, start CPR. All right. This is to buy time. All right. Because CPR is not so much on reviving the person. All right. It's more to keep the heart, all right, pumping oxygenated blood to the brain. How the heart pump? This is where you need to do the compression. All right. And then how to make sure in the blood there is oxygen. That's where we do mouth to mouth. You blow in air to the lungs, so then you pump and bring the oxygen to the brain. All right, we try to maintain the brain to be alive. Okay, when your heart stop, your brain has about 4 to 6 minutes. All right, the brain cell will start to die. All right, that's why you need to keep the oxygen to the brain to maintain the brain function. Okay, right. So we want to start CPR as early as we can. Okay, next is what we call early defibrillation. Right, this is where nowadays you will see in malls, in offices, okay, or in airports. All right, you will see a defibrillator. Okay, a defibrillator is what you see in the movies. All right, when there's someone suddenly like die, right, and they will say, okay, charging, clear, giving electric shock. Right, that is defibrillation. All right. So this is where we restart the heart. All right, it's like those drivers. Okay, is to jumpstart the car. All right, so for us is to jumpstart the heart. Okay, so we use a device what we call a defibrillator. Okay, and AED stands for automated external defibrillator. All right, so it's an automatic. All right, you do not need specialized training. All right, to know how to use it. Okay, if you have gone through the website, they will have shared with you the steps. All right, so that's automatic. It's easier to use compared to the one in the hospital. Right, E stands for external. Right, meaning it's outside. It's not inside the person. All right, if you heard of pacemaker, all right, if you heard of pacemaker, pacemaker is an internal defibrillator, meaning it's it's wired to the heart, the person's heart. All right, and then the defibrillator is right under the skin. All right, so when it detects abnormal rhythm on the heart, you automatically give a small electric shock to the heart so that the person don't go into cardiac arrest, meaning the heart stop fully. All right, so that's an internal defibrillator. So what we use are external defibrillator. All right, the next link on the chain is early advanced life support. This is where we want to stabilize the casualty. All right, so this one, early advanced life support, can be done by the ambulance at the hospital. All right, so for us, our job is as early as possible we get help, as early as possible we start CPR, And if there's a defibrillator around, we give defibrillation as early as possible. So with this chain, okay, we start as early as we can, the percentage of survival of this person, it increases. Okay, right? So early access, I'll cover this a little bit fast. Okay, when you call for 999, all right. So we call 999 to get ambulance as soon as possible. All right, Malaysian number is 999. All right, don't call 911. It will not come. All right, it's an American emergency number. All right. Now, if you are using a mobile phone, all right, in Malaysia you can still use 999. But if you are overseas, okay, if you are overseas, all right, you dial 112 on your mobile phone. All right, 112 is programmed in your phone, okay, programmed with the service provider. When anyone dial 112, it will connect to the local emergency number. Right? So, for example, if you are like in Singapore, what's the emergency number? You may not know. Those in Miri, what is the emergency number in Brunei? If you happen to travel there, all right? So you wouldn't know. So if you do not know and you have your mobile phone, you dial 112. It will take a bit of time to detect the emergency number there, but it will get you through the emergency number of that country. All right, so this is a handy number for you to remember. All right, 112. If you do not know the local number, if you know the local number, call the local number. Like in Malaysia is 999. All right, so when you get connected, mention the type of services you require. Okay, you want ambulance, you want bomber, or you want police. All right, and then they will pass you through if you are not connected to them. Okay, so when they pass you through, okay, wait on the line while they connect when you are connected to the operator. All right, and then once you are connected, give as much information as possible. All right, I will encourage you to say your name and your contact number early. All right, why? Because you may be disconnected halfway. All right, so we have a contact number. All right, that you can call you back. All right, or the ambulance will be dispatched usually within 1 minute from your call. All right, so 1 minute they receive the call, right, they will start dispatching. All right, once they know where to head to, like for example, they need to head to your school. All right, so they know where to head, you just start to dispatch and just go straight towards your school area. They may not know the exact location, but they start to head there. Right, but again, if, like I said, if halfway your call get disconnected, right, at least the ambulance, okay, they have your contact number to call you back, or if they reach the area they cannot find you, they have your number to call you back. All right, so next thing you tell is the full location address. Tell as detailed as possible. Do not just tell your school name like everyone knows where your school is, right, or your house number. All right, that is a very important number. All right, if you have house number 25C, you mention 25C. Don't just tell house number 25. You left out the C. All right, you may have the ambulance may reach a place where all the house number is 25, but it's 25A, 25B, 25C, 25D, and all. All right, so it may not be able to define where exactly you are. All right, if there's no address, okay, what you do is give the nearest road or junction. All right, and landmarks and how far from the landmark. Okay, don't give landmark that is like 2 or 3 kilometers away. All right, like in KL, oh, I can see the KL tower, but it's like what, 3 kilometers away, right? No. All right, give a better landmark for them to find. Okay, or the easiest is you just see what is around you, what tall buildings that is around you that they can actually see. All right, so once they see it, they will actually circle around it. That's why when you say the distance from it is about like 200 meters or 300 meters, then they will circle around that landmark to find where you are. Right, and then explain what has happened. All right, how many casualties. This again, one ambulance usually they will take 2 patients the most. All right, otherwise if there's many casualties, there are like 5 casualties. All right, they may need to send 5 ambulances. Okay, and then one hospital they may not be able to send 5, so they may need to get help from other hospitals or from the Red Cross or the St. John, right, to send the ambulances. Okay, so they need to know how many casualties and what is their condition. Right, same thing if you see the person is confirmed dead, like for example, the head is totally decapitated. All right, the head is not attached to the body. you know, you don't need any medical training to know this person is confirmed dead. Right, then you tell them there are 5 casualties, 1 confirmed dead. So then they do not need to send 5 ambulances. They only need to send 4, and then 1 will go into the police lorry, okay, for the dead body. All right. Okay, so you tell them what's the condition, all right, and then the treatment that has been been given. All right, who is treating the patient? Okay, what treatment you are giving? All right. Nowadays, 999 they are being trained, right, to give verbal instruction on how to do a first aid, right? So that would actually help a lot, okay, on how if those who do not know first aid or don't remember the training, okay, they are trying to do that, give you instruction on via the phone while the ambulance is on the way. Okay. Now next will be early CPR. All right, early CPR. Very easy to do. Later I'm going to demonstrate. Okay, and if you have a pillow beside you, all right, and an open area, a floor, all right, where you can actually practice together with me, that would be great. Okay, otherwise you just have a look, all right, and then maybe practice later. All right, so early CPR, the acronym will be CAB now. All right, but before all that, okay, we have what we call a danger and respond. All right, but here I'll just go straight to respond, whereby you tap and shout. You check whether the person has response to you. All right, like for example, you tap at the shoulder, you shout the person, hello, can you hear me? Are you okay? Right, if the person do not respond, right, that means the person may be unconscious. Right, but if you tap and shout, hello, sir, are you okay? He wake up and respond to you, then you do not need to do CPR, because when the person wake up and responds to you, that means he is breathing, his heart is functioning. All right. So if you tap and shout, there's no response. The person is like totally sleeping and dead asleep like that. All right. You tap, you shout, you pinch the shoulder. All right. No response. Then you get help. All right. That's where number 2 is. You get help. Then number 3, you check whether the person is breathing or not. All right. You check the person is breathing or not. How you do this? I'm going to demonstrate later. All right. Then you're going to see compression. All right. And then airway and breathing. You open the airway and then you give 2 rescue breaths. However, now in COVID time, we don't do airway, we don't do breathing. We only do compression, okay, which I'm going to demonstrate to you shortly. All right. Okay. Now I'll turn on my other video, where is my other camera is on the floor. Right. So I'm going to demonstrate there. All right. I'm going to stop sharing from here. And you will view my other login. Okay, that's where you're going to view my video while doing CPR. All right, so just a moment. Let me switch camera. Okay, can all of you see me on my other ID? Right, you may need to tag Chanzili. Okay, you can double click and then my view will be up. Okay. All right, so I have my mannequins here. Yeah, let me view a little bit. All right, so you can have your pillow, okay, since you do not have a mannequin, all right? You can have your pillow, you can practice together with me, all right? Now, do not practice on the real person, okay? Do not compress on the real person. You can get a friend to lie down and do all the steps, right? But do not compress on the real person, okay? Now, if you are doing on a pillow, then fine, you can compress on the pillow itself, right? Now, what do you do, okay, in CPR, right? So we have the acronym DRCAB, all right? Like I shared just now, D stands for danger, right? You check whether the surrounding is safe or not, all right? if it's safe, then when you approach, okay, like again, and now in COVID times, okay, you will need to wear your mask, okay. The person, okay, if he's not wearing the mask, right, you can get a towel or something to cover, okay, but not to the extent that he cannot breathe. All right, if you have extra mask, put the mask on that patient, okay, because again, this is COVID time, all right, while you're doing CPR, halfway the person may suddenly wake up and then cough, right, and then if the person is COVID positive, he cough, you may get the virus, okay, so that is where the approach is a little bit different, all right, in this COVID time, all right, so if you see the person is unconscious, all right, okay, you approach the patient, okay, if the person is not wearing mask, wear the mask for him, okay, or you get a cloth, just cover, all right, so like for example, I have a cloth here, I just cover the face and the mouth so that if he cough, suddenly you go into the cloth, okay, right, now next, okay, is you tap the shoulder, check for response, okay, you shout, hello, hello, can you hear me, right, you can pinch the shoulder, all right, pinch the shoulder here to see any response, whether he's moving or the eye is moving, all right, or he responds to you, ouch, all right. So if there is any response, that means the person is breathing, okay, and has the pulse. Okay, now if you tap and shout, hello, hello, can you hear me? Hello, hello, can you hear me? There's no response, right? The next thing is to get help, all right? You need to get help, all right? Call 999 if you're alone, all right? Take your phone out, turn on the loudspeaker, put the phone next to you, and then you can do your CPR while talking to the ambulance, the 999, all right? Don't waste time holding the phone. The patient is right now here, right? And you talk and talk and talk to the ambulance, okay? You can turn on your loudspeaker, put it down, and talk to the patient, okay? Right? Can anyone see on full screen, all right? Okay, you may need to tap on top, okay, you can see all the bubble there, okay, you tap my face, you double tap, then you should be able to view full screen, okay, right, all right, okay, now back to here, okay, so once you tap and shout, there's no response, get ambulance. If there's people around you, get the person to call 999 while you do your CPR, all right, so next, you tap and shout, you call ambulance ready, no ambulance, ambulance on the way, all right, if you know there is an AED nearby, get the person to bring the AED, okay, automatic external defibrillator, okay, right, now, if there's no AED, it's fine, you need to start CPR soon, all right, so you call ambulance ready, next, what you need to do is you check whether the person is breathing or not, because the person is breathing, you do not need to do anything, you need to just turn the person on his side, okay, turn him onto the side, okay, so that all the vomit, whatever, can come out from the mouth, okay, I just let him lie down on the side, right, but if you check the person is not breathing, then you need to do CPR. Now, however, how are we going to check breathing, okay, now, in formal first aid session, okay, we're going to teach you is to check like this, okay, but again now, right, we are doing online, so I won't be able to teach you properly how to do this, all right, and at the same time also, because it's COVID time, you do not want to have your face near him, all right, so we are going to skip that, all right, so what you're going to do, how are you going to check breathing or not, all right, the person is breathing or not, look at the chest, okay, what you want to do is to see whether the chest rise or not, okay, go up, come down, go up, come down, all right, observe for about 10 seconds, okay, so you look at the chest, you do not need to touch the patient, look at the chest, whether is it going up and down, if it's not moving, then the person is not breathing, okay, however, if you are in doubt, okay, the person is breathing or not breathing, look like breathing, look like not breathing, if you are in doubt, assume it's not breathing, okay, right, so what you're going to do next, all right, is compression, all right, is this what we call compression only CPR, okay, so compression only CPR, you only need to compress, you do not need to blow into the mouth, Okay, so how are you going to do compression only CPR? All right, first you need to know where the chest is. Okay, I think all of you know where is your chest. This is your chest. All right, this is your tummy. All right, so you need to know, the chest is up here, it's not down there. All right, so the chest is up here, the center of the chest. All right, this is the center of the chest. All right, in between the two nipples. All right, if female, the easiest between the two breasts. All right, that is this bone. All right, if you feel yourself, this bone is solid, it's hard. This is where you need to put your hand. All right, not on the tummy stop, on the hard bone, sternum bone. Okay, right, so middle of the chest. All right, if the person is wearing a shirt, all right, like what I have is wearing a shirt. All right, you just remember second button. At the second button, that is the tip. All right, if wearing a shirt, second button, that is where you need to put. All right, otherwise, if you're wearing round neck shirt like mine, center of the chest. So remember, center of the chest. All right, you need to put the base of your hand. All right, not the fingers, the base. That's why when we do CPR, it's always we grip like this. This one is touching the bone. Okay, the sternum bone. Next, what you do is, okay, straighten your hand, lean forward. You need a 90 degrees straight down. All right, so you need to kneel and then hands straight. Okay, your elbow straight. Do not bend the elbow like what you see in the movie. You'll be very tired very fast. All right, so you, okay, lock. All right, so you lock. All right, and then you compress. Okay, right. So I'm going to come onto this side. All right. Okay, so you can see. Okay, so you can see here. All right, I need to be 90 degrees straight down. All right, this is where I'm going to do. All right, and then I don't use my shoulder length. I use my back. Okay, I'm going to move like this. Okay, when you compress, do not shake your head also, front and back. Okay, you're going to get dizzy very fast. All right, so you're going to compress, all right, like this. Okay, now for compression only CPR, you continuously compress. All right, you continuously do not need to stop. All right, right. But our guideline is, all right, you compress about 100 times or about 1 minute. Okay, in 1 minute you continue to compress. All right, and then after the 1 minute you rest for a while. You check the person is breathing or not. Okay, if not breathing, continue again about 100 times. All right. Okay, now how deep you need to compress? Let me turn back here. Okay, how deep you need to compress? All right, the depth is 1/3 of the body. Okay, 1/3. All right, or if you measure in centimeters, is 4 to 5 centimeters. All right, this is where when you have a mannequin, you will hear the click click sound. Okay, that is deep enough. All right, but on the real person, you won't be able to hear the click sound. So just remember about 1/3 of the body. Okay, so the length 1/3. Okay, that's how you need to compress. All right, you press according to a rhythm. All right, you compress according to a rhythm. Okay, what rhythm it is? Okay, for those who are more senior, all right, you will have heard this song "Staying Alive." All right, so you follow the tempo. All right, so for the younger generation, you may not have heard this song. Okay, "Staying Alive" is an old Bee Gees song. Right, so the latest song that all of you would have known is what we call the Baby Shark song. All right, so the Baby Shark, so you follow the Baby Shark tempo. Right, the Baby Shark, that is the correct tempo. Okay, in terms of speed, which is about 100 to 120 times per minute, or about 2 compression 1 second. Okay, right, so you need to compress 100 times. So you go like this: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 71, 72, 73, 74, 75,
75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100. You stop for a while. Okay, check for breathing. Go, the chest rise or not. No breathing, continue again. Alright? Okay, so that is CPR. Alright, during COVID times, you do not need to do blow. Alright, but remember, cover the patient's face. You have your mask on, and then you compress. Okay, 100 times only. So this is compression only CPR. Okay, right? So that is for CPR. Alright, I'm going to go back to the my other screen. Okay, so for some question and answer, right, before we end this session. Okay, so just hold on for a while. All right. Okay. Okay, so we're back. So it's almost 5, it's 4:50. Right, so we are done with all the practical sessions, okay, all the learnings and sharing. Right, so back to questions. Any questions from any one of you, right, before we end the webinar session? All right, so I repeat here just now CPR. All right, so you type and shout. Okay, if the person is not responding, get help. All right, look for 10 seconds, look for breathing. Okay, any chest going up and down. Okay, for 10 seconds, no breathing, start with compression. So again, during COVID times, right, press 100 times. Okay, in normal scenario where you attend basic first aid, right, that would be 30 compression, and then you go into airway, you blow the blow air into the lungs. But in COVID times, we discourage that. Okay, so you just do 100 times compression, okay, or for about 1 minute. All right, and then you pause for a while, see the person is breathing or not. Okay, now when do you need to stop doing CPR? All right, there are 3 scenarios. Okay, actually 4 scenarios. All right, the first scenario is the person got pulse and got breathing again. All right, so if the person you do halfway, 40, 50, you press, suddenly the person, okay, got response, you stop CPR. All right, number 2 is the ambulance has arrived. All right, the ambulance arrived, you can stop. Okay, or number 3 is, okay, the person, number 3 is when you are tired. Like you can see me just now doing 100 times of compression, it can be tiring, especially when you are not physical fit, okay, or you don't do it a lot of times, okay. When you're too tired, stop doing CPR, all right. And then the 4th scenario is if you call for an AED, okay, automated external defibrillator. When you call that, when the defibrillator arrives, the person come back to you, sir, here's a defibrillator. You stop, you put the defibrillator on to that patient, all right. So these are the 4 scenarios that you stop, where you can stop doing CPR. Right, so I get a question from Grace. Right, when do we shout? Do we shout to ear? All right. Now the best is yes, we shout to both ears. All right, rather than the face is there, you just shout, "Hello, hello, can you hear me?" All right. If you can shout left ear, right ear. Why? The person may be deaf at one side. All right. So you test. You shout at this ear, "Hello, hello, can you hear me?" You shout at this ear, "Hello, hello, can you hear me?" All right, now again, the person may be deaf both sides. That's why you have the tap. All right, so you tap the shoulder, right, as well as you shout. Okay, rather than too far and then you shout. Okay, the best is you shout left ear, you shout right ear. Okay, especially those old casualties, okay, senior citizen, their ear may be a bit deaf, so it's best for you to shout a little bit closer. All right, so again, during this COVID time, like I said, you need to make sure the person has that mask on first. All right, you have your mask on first.
All right, so both have masks, then only you tap and shout. That would be safer for you to do. Okay, right? So that's the wrap up for CPR. All right, so 4 scenarios that you can actually stop CPR. All right, first, patient is okay. All right, got breathing, got pulse. Number 2, ambulance arrived. Number 3, you are tired. Or number 4, the AED has arrived. Right, so these are the 4 scenarios that you can stop doing CPR. Okay, right? Any more questions from anyone before I go on? How does AED stick to the chest? All right, good question. Right, the AED actually is already sticky itself. Okay, all right. Let me try and get my AED. All right, actually it's like a sticker itself. All right, let me stop sharing so you can see easier. All right, so I have an trainer AED. Right, this is a trainer AED. Right, so when you open it up, okay, right, the pads are here. All right, so when you open the pads up, okay, there are labels. All right, so there are labels here. All right, so like this one, it goes up here, okay, up the chest. This one goes under here. All right, so when you peel this off, all right, when you peel this off, you see here, okay, okay, you see here, this is the sticky part. Okay, this is where it's going to stick to the patient's body. That's why AED, this pad is one-time use only. Once you use already, right, because you stick to the person's chest already, sorry, this side, okay, they have to throw already. Okay, they cannot reuse again, wash, clean it, no. Use one time, they will change. Right, so when you peel it off, the whole thing will come out. So this is a sticky part. This is a sticky part. This is where the whole thing has to stick fully. You do not leave any gap like this. Okay, do not have any gap. Make sure it fully stick to the person, and then make sure the person is not wearing any shirt. It has to be bare skin. It has to be straight onto the skin. Then only it sticks properly, right? Because on the shirt it can move. Okay, right? So that's how the AED sticks to the chest. Okay, and of course, on top of that, if the person, like a male, they have hairy chest, right? That's why sometimes in the AED itself, it comes with this, okay, for you to shave off not all the hair, but just the part that you need to stick the pads on. All right, so sometimes you have that because with hair and sticky things, it doesn't stick properly, right? So it will come with this, right? And then sometimes it will come with cloth because you may pull the patient from the water, so it's wet. Electricity and wet is not good, so you may need to dry the skin first. All right, but the most important thing you must remember is you cannot have the patient wearing the shirt. It has to be bare skin. All right, so you must take out the shirt. If you're wearing t-shirt like this, you will need to take the scissors out, okay, and then cut, open it up, okay. Right, so that's for a quick talk about AED. All right, that's from Selina, I guess. All right, any other questions? All right, you're welcome. All right, sorry for the slight delay. Okay, it's almost 5 now. Okay, I give maybe another minute. Anyone have any other questions? Right, before I throw you more questions through the quiz, right, through the online quiz. Okay, I think no more questions from anyone. Right, so if you have any more questions after this, right, you can still continue to use this chat group. All right, you can post a picture there. All right, I will try to respond there. Okay, right. So I shared earlier the video, the link on how to tie the sling. Okay, and
sorry, Tarish, do we have to screenshot the final result of the quiz? For the quiz, it's all right. Okay, you screenshot once you are done. Okay, once you submitted, right, the result will be there immediately. Okay, and then you screenshot and then you can WhatsApp to me. Okay, or you can post it here as well. All right. So that's for your final result for the quiz. All right. Let me. All right. Now, for those who are going for your Lencana Ahli Petualang Cemas, okay, right? This quiz is actually open book. That means you can actually Google your answer. Right. So you're open to find the answers. Okay, and answer it. Right. With that, right, I've increased the passing mark to 80%. Right. So you have passed. You have 80%. You score 80%, that's where then you will you'll be considered you pass the test. Okay, you can get your Lencana Ahli Petualang Cemas. Alright, however, if those who have already done your Ahli Petualang Cemas, alright, then the passing mark doesn't matter. Okay, as long as you complete it, then I'll prepare the certificate for you. Alright, so you have a certificate that you have attended, if you completed the first aid training. Alright, it's an e-certificate lah. Right, so I will drop an email to you on your certificate. Right, so in the form there will be the asking for your full name and also asking for your email address. All right, so I'm going to, if there's no question, all right, so I'm sharing the link to the quiz now. All right, so actually I'm giving all of you, those who attended today, okay, 3 days to complete the quiz. All right, but for those who did not, those who are doing the SEAL challenge, okay, mission SEAL, all right, so you have actually more time. You can actually view, actually recorded this session, so they can actually listen to this session, right, and then answer the quiz. All right, so Tarish, I'm sharing the form now. Okay. Right, so this is the link for the quiz. All right, so you can submit. I'll only request for your email address. Make sure it's correct. All right, and also your full name. Right, so I'm going to base your certificate on that full name that you key in. All right, and then I'll generate certificate for you. Those who have completed all the 17 lessons, first aid lessons on the website, as well as those who have completed this quiz, right? So that then you will be getting a certificate, right, from the British Red Cross, all right, signed by myself, all right. So you will get that certificate. So let me share a little bit example of the certificate that you'll be getting. All right. Okay, this is how the certificate going to look like. All right, so you'll be getting a certificate of first aid training. So your name will be here. Right, I successfully learned first aid skill. Right, the date, and then I will be signing here. All right, so this certificate you can print it out. All right, and then put it together with your logbook as a sign that you have completed the first aid training. All right, so that is it's not an assessment because as first aid assessment we will need to see you doing first aid. Okay, but now it's more of a webinar session, so I don't really see you for what you have done. So this is the email. This is a certificate that I can give you. All right. So any more question? One last minute. Okay, for questions and for anything you want to ask. All right. Okay, I think if there's none, okay, so this, thank you for all your time, okay, spending this 2.5 hours, sorry for the slight delay, all right, so I hope all of you learned something from the website, from the online session,
and so you have learned something from today's session as well. All right. So again, if you have any further questions after this, right, you can actually post it on this chat group. All right, I will answer it from time to time. All right, so that's all from me for today. All right, thank you all. Okay, have a good evening ahead. All right, and back to school tomorrow, I believe. All right, for adults, we'll be back to work. All right, so I thank you all of you again. All right, have a good time, have a safe time. All right, keep safe. All right, keep your physical distancing. All right, keep safe, everyone. Thank you.
All right, thank you, sir.